When did my journey into natural medicine begin? I guess I'd have to go back to a snowy set of mornings in my hometown of Owen Sound, Ontario. Covered in bruises, my pillow stained red each morning from persistent nosebleeds. I was tentatively diagnosed with leukemia. I was 5 years old. After a second series of lab tests, I was rushed to Sick Kids Hospital in Toronto where my condition was downgraded to thrombocytopenia. After a bone marrow biopsy and an additional series of tests, I was transferred to my local hospital where I was kept under observation for several weeks. The doctors and specialists were perplexed and could offer no explanation as to how this condition could arise in an otherwise healthy child. More disconcerting was that they could offer no suggestions on how this condition might improve. One day, as late winter had turned to spring, my mother arrived to the hospital with a large mason jar full of wild dandelions and olive oil and lemon. She put them on my plate and she suggested I eat them. The next day, the doctors and nurses were amazed at the reduction in the size of bruises on my body. By the end of the week, they were virtually gone. My nose and gums had stopped bleeding, and my lab work was amazingly returning to normal. Within a month, I was as healthy as I had always been. This was my first experience with food as medicine, and an experience which I believe fundamentally influenced many of my future decisions and directions as a doctor. I started my practice in the summer of 1999 here in Barrie, Ontario, with the idea that a small-town chiropractor could really make a difference. Since that time, I've seen a colossal shift in primary care. Small family medicine clinics have rapidly disappeared, replaced with large industrial walk-in clinics with a roster of rotating doctors. Care times have increased while actual care has decreased. Signs are now routinely posted asking patients to limit questions and concerns to one or two issues. Healthcare has become sick care. Frustration amongst family doctors is forcing many to leave the profession. By 2009, I too had reached my threshold. On the heels of completing a speaking tour across North America in support of lifestyle medicine, it was clear to me that my experience and expanding skills had begun to exceed the scope of my practice, and more importantly, the needs of my patients. If I was ever to fulfill my vision of a better primary care practice, I knew a secondary medical degree was necessary. And so began my 6-year odyssey to complete my naturopathic medical degree, my prescribing license, and my IV certification. Each morning I would see patients, then drive to the college or to a clinic, drive back and see patients again until well into the evening, go home, tuck my kids into bed, and study well into the night. Wake up and repeat. When board exams rolled around, sometimes there was no sleep. What kept me going beyond the love of my wife and my kids, my amazing staff, the support of my patients, was this idea of what primary care family medicine could be. I imagined a medicine that uses lifestyle and nutrition first and drugs second. Primary care is by its very definition the first care or contact, the first opinion. The reality is that good doctors treat people, not diseases, and I think that this doctor-patient relationship is perhaps the most important in all of medicine. For me, primary care has to emphasize prevention over intervention and prioritize the collaborative use of powerful, safe, and drug-free alternative medicines such as plant medicines, chiropractic care, and acupuncture whenever possible over opiates and other addictive and harmful substances. Primary care should respect and acknowledge each patient's unique biochemical and individuality and emphasize the optimization of both structure and function. Primary care, above all, should respect, not subvert, the healing connection we have to our planet. So today, when I treated the 46-year-old male recovering from a recent heart attack, anxious about his future, or the 65-year-old who had just been diagnosed with prostate cancer and yet has so much life left in them, or the 19-year-old I saw dealing with depression and anxiety, I think about that 5-year-old boy and his parents, scared out of their minds, faced with the fear of the unknown. And I've come to realize how far we've come and how the future of primary care may actually be closer than you think. Till next time, be well.
Hi everyone, and welcome to PHAMCAST. I'm Margaret Wallis Duffy, and I am beyond excited to have a very special edition of PHAMCAST today in celebration of Preventative Health Awareness Month. So I'm going to put my glasses on because I want to properly introduce this special guest that we have in studio today. As we celebrate Preventative Health Awareness Month, I'm beyond excited and deeply honored to have Dr. Stephen Rallis with us today. An esteemed ambassador and guest, Dr. Rallis is not only a respected leader in his field of integrative medicine, but also the Chief Medical Officer of DRIPBaR Canada and a founding member of the Scientific Advisory Board of the American IV Association. His dedication to health, education, and research has left an indelible mark on the medical community. Dr. Rallis' impressive credentials include his undergraduate degree in biological sciences from Western University, his chiropractic degree from Parker University, and his naturopathic medical degree from the Canadian College of Naturopathic Medicine. But behind these accolades, what truly sets him apart is his unwavering commitment to advancing the treatment of cancer and metabolic diseases. His work in integrative medicine, combining conventional and alternative approaches, has not only helped countless patients, but has paved the way for future medical students, as his Barrie-based practice offers one of the first integrative medicine rotations. Bravo. What many may not know is that Dr. Rallis' passion for health and healing has a deeply personal root, and you saw his story at the beginning of this show. Dr. Rallis has since become a well-known author, an international lecturer, and an advocate for integrative health, teaching and inspiring people across North and South America and Europe. His vision continues to influence how we think about medicine and wellness today. We're so fortunate to have him here with us and his expertise and insight. I also, of course, having back to the show, Dr. Christy Prowse, a colleague, a friend, the CEO, the Chief Medical Officer of Regena Life. I have to tell you, Dr. Prowse was instrumental in my health and well-being as the founder of the Institute for Hormonal Health. She saved me, really. And having them both on today is not only a privilege, but I'm so excited. You're in for a treat. Welcome to you both. Thank you.
Thanks for having us.
Yeah. I just can't wait to dive into this conversation. And when we, at the beginning of the show, aired your clip about your story and about, as a child and what that looked like for you. When I watched that, not only was I touched, but I was like fired up because your life's work now has reflected that story as a kid. And I can so relate to that because that's my story. I mean, different, but the same. Tell me a little bit about why are you doing what you're doing?
I think everyone has a calling. I mean, I think that's an embedded, we all know our purpose, or we spend our lives looking for it.
Yep.
And which is interesting. In that, I talk about my mom we were the only Greek family in our neighborhood. And so we didn't use, at that time, having sort of golf green lawns was all the rage.
Yes.
So we had the ugliest lawn in the neighborhood.
Full of those beautiful dandelions.
Yeah. She said, why would you put, so when they said, Mary, why aren't you using fertilizer and pesticides? And she said, what would I do that for? She said, all those nasty dandelions would be gone. And she said, what?
What are you talking about?
She had this huge lot that had all of these dandelions. So anyway, spring had turned into summer. She brought in those dandelions. I was in the hospital covered in bruises, and there was no answer. I'd been transferred from Sick Kids to our local hospital at Owen Sound.
Go Owen Sound Attack. I had to say it. My cousin was the coach of the Owen Sound Attack and took him to the championships.
Wow.
Just had to say that.
Yes.
So we love Owen Sound. Sorry, I digress.
Huge source of pride.
100%.
And I remember very vividly because they had put me in this sort of crib, and I was at that time 6 years old, and it was, I remember being embarrassed because I thought, I'm a big boy.
Right.
Why am I in a crib? But the crib was padded because I was covered, the length of my femur was a bruise, my arms were bruised, everything was bruised. And what was most disconcerting to my mom was the food they were feeding me. And so winter had turned to spring. dandelions had come out. So she came into the hospital, this big mason jar full of dandelions, olive oil and lemon. And she said, I want you to eat these. And she wasn't saying it in a medical way. Like, she wasn't thinking that this is some kind of, treatment or nutrition or food as medicine. She was essentially just saying, look, you're not eating very well here.
Right.
Pick these, eat them. Like, you've been here for like 2 weeks, you haven't had a single vegetable. Long story short, I ate them, devoured them actually. And within 48 hours, those bruises were effectively gone. And who knows whether that kickstarted my liver, whether it was part of the detox. Anyway, that was surely part of my journey. And it's interesting, when I had when I was looking at extrapolating on my medical career beyond chiropractic, and I walked into the Canadian College of Naturopathic Medicine, and there was the first thing I saw when I walked in was a picture of a dandelion on the wall. And I thought,
welcome home.
Yeah. So I knew I was in the right place.
Yes.
Even though trying to get an additional medical degree while running a full-time practice was insane. I'm very blessed to have, an understanding family, an amazing wife, because there's no way.
No.
And actually too, was our patience, was how understanding that there's a bond that happens in primary care between a doctor and a patient. And if done right, there's a lot of love there.
And there should be.
Yes. And mutual respect.
Yes.
And when it goes sideways, it becomes a transactional experience for both the doctor and the patient. And that's where care is lost. And you see that because, it just becomes like, oh, I just want this prescription refilled, or I just want this, or I just want that. And when it's not, but when the patient cares about you and you care about the patient, it's amazing. And you would be able to speak to that for sure.
Yeah, and that's the most fulfilling part of being able to have the honor of serving people.
Right.
It's an exchange, and we get from it as well.
Well, what you said is the serving part is just so huge. We have the luxury of seeing a lot of young students, chiropractic students, naturopathic medical students, and now medical students.
Yes, bravo.
Actually, we do rotations, integrated medicine rotations, and research with medical students and through the Trinity School of Medicine, which is an amazing honor for me too, as much as for the students. But every one of those students that come in, I said, do you like to serve?
Yeah.
Could you see yourself as a waiter or a flight attendant? Or, could you see yourself cleaning toilet?
You know what? I love where you're going with this, because the hierarchy that has existed in medicine, and don't get me wrong, I've got many friends that are physicians and specialists, and they're amazing people, and they are there to serve, but our system has set it up where there's the patient here, the physician there, and don't get me wrong, you're going to get help from somebody with more knowledge than you have, and there needs to be that mutual respect. But we know our bodies too, and in complementary medicine, as I like to say, and people, as I'm a proud registered massage therapist with all kinds of other, designations to go with it. But that is exactly it. It's the being in service and willingness to collaborate and be there to serve on the same level, like you just put it, is critically important. But yet, that's not what currently exists. And that is incredibly refreshing to hear you say it in that candid way.
Yeah, it has to be candid.
Yeah.
Because it's, and, it's funny, healing is an ancient art.
Yes.
But it's a female art. The male energy is meant to be directive.
Yes.
It's meant to induce change. It's meant to be forceful, and there's a real place for that.
Yes.
But healing and nurturing is the feminine side.
Yes.
And doctors, to be good, need to have both.
Yes.
They need to find their male voice to give direction. To promote confidence, to instill confidence. Like, and Dr. Prowse is a perfect example. She has a female healing energy and a strong male
She
voice.
sure does.
She has her doctor's voice, obviously, with that many years of experience, right?
Yes.
But
it's innately who she is too.
right, it is innate. And,
Yeah.
and you'll see that amongst a lot of young doctors, that the reason patients will think that they're wishy-washy is because they're not, or they're too forceful, both of which aren't good.
Right.
You know, you have to find that balance. And that's something that we do try to teach the students. That's part of the art.
Right. Yeah, and to hear somebody talk about art as medicine, I mean, for so many years, you know, I'm going to speak candidly, as a massage therapist and laying on of hands. And I remember when I first opened Wallis for Wellness 33 years ago, my own family, I'm a science girl, my own family thought I was hugging a tree and howling at the moon. Like, what is this preventative and integrative thing you're going to do? And I called it Wallis and Associates. You want to know why, Dr. Rallis and Dr. Press? Because I wanted it to sound like a law firm so people would take me seriously. Has it changed over the course of 33 years? Yes. Have I worked at that and earned the respect of my colleagues in conventional medicine? Yes. However, what you're saying at the root core of this, and you said this before we were on camera, functional medicine is really the only medicine. Speak to what that is, because it's really important that we recognize what it means to take agency for our health and the role we all play in it. And I'm at this table today because this matters. This movement matters, and these conversations matter. We've come a long way, but we have so much more to go. What is functional medicine, and why is it important?
Functional medicine is the lens through which you view the patient. It isn't about being a chiropractor, or naturopathic doctor, or a medical doctor, or an oncologist. It's how you view the patient. And prevention is part of that functional apparatus. It's part of that window. And right now, when we talk about prevention in conventional medicine, we really are talking about early detection.
Right.
That's not prevention.
Right.
The best analogy would be that if you were trying to prevent poverty, the way to do it would be to build wealth, right, not to focus on finding people that are early onset broke.
Right.
Right. It would be to teach people how to generate wealth.
To empower them.
To empower them. And the wealthier they were, the less broke. So in health is a positive. It's an outcome. And you can always improve your squatting ability, your cardiovascular health, your blood pressure, cognitive health, digestive health, your microbiome.
Yes.
So when we look at inflammatory markers, like the one thing that I always say is, like, especially in today's day and age, we are enraptured in a metabolic disease epidemic. And that metabolic disease epidemic affects cardiovascular disease, neurological health, cancer, et cetera, pain. And insulin is the canary in the mine shaft. Fasting insulin will always be the first thing that elevates in metabolic disease, before blood sugar, before triglycerides, maybe not triglycerides, but before A1C, before blood glucose, before most metabolic markers will be insulin. And then there will be inflammation, because coupled with this metabolic change is inflammation. And it's the inflammation which causes the disruption to our organs.
Right.
Aging, accelerated aging, cardiovascular disease, cancer, et cetera. So the question would be, if we knew that, if we know that we're in a metabolic disease epidemic, where there's more children now with diabetes, that the statistics is logarithmic in terms of the exponential growth. So in primary care, how often is fasting insulin measured? How often are inflammatory markers measured? ESR, CRP, two cheapest tests. They're $3 at Life Labs.
Right.
Or fasting insulin. How often? The answer, sadly, is never.
Right.
Not only is it never, if you ask a family physician to run them, they'll say there's no indication. In an epidemic.
Right.
So prevention is miles away. It's not even close.
Yep.
And except for those that begin to see the paradigm as functional, meaning that if inflammation is 3 for CRP and we can bring it down to 1, that's a significant change. Disease doesn't happen at 3, but the disease process does.
That's right.
right? So if we can improve metabolic, if we can improve fasting and insulin, A1C never goes up. If we can improve sedimentation rate, which is just a general marker, and the list goes on and on. In terms of, Dr. Proust obviously has expertise in hormonal health, but her expertise goes far beyond.
For sure does, yeah.
And you would understand too, and Dr. Proust was referring patients to our office. And the first thing that impressed me when I first saw her labs and her patient referral was, holy crap, he is this doctor.
Yes.
That is like examining from liver enzymes to kidney to functional tests to all the hormones to salivary tests to on and on. Like, I was so blown away. I was your biggest fan.
Maybe not our biggest, but yeah.
I was your biggest fan. I said, this doctor is phenomenal. She was off the charts phenomenal.
Yeah.
And in fact, there would be tests on your lab requisition that I would then copy, because I would say, wait a second, I didn't check that, and that has value too.
That's called learning from one another.
Right.
Which I'm going to stop you there because we're going to be back. We're going to take a break here. We got so much more to dive into. So hang on, stay tight. We'll be back with Dr. Rallis and Dr. Proust here on PHAMCAST.